Good morning. Javier Becerra, Chairman of the House Democratic Caucus. Pleased to be joined by, as usual, our Vice Chairman of the Democratic Caucus, Joe Crowley of New York. And today with us, Rosa DeLauro of Connecticut, who's been one of the principal champions on our effort to make sure that Americans are protected from the Zika virus. She does a lot of things, but right now she's been focusing a lot of her attention on the Appropriations Committee on making sure we provide the resources. And we're joined as well by my colleague and friend from California, Adam Schiff, who is our ranking member on the Intelligence Committee, who also is a member on leave from the Appropriations Committee and understands the hard work that goes into making sure we provide the resources where we need them. We're here again today. Seems like we're talking about pretty much the same stuff. We come in, 435 members in the House, 100 in the Senate. We punch the clock. We get paid, but it doesn't look like we get very much done. Certainly not the work that the American people would expect us to get done. And specifically on something like a health emergency like Zika, the Zika virus, where we know that if we don't do something before mosquito season really comes full bore upon us, that we're going to probably see Americans infected in ways that could cause some devastating impacts, especially if you're a woman, especially if you're childbearing, especially if you are in the process of delivering a child. And so it's time for us to not just punch the clock in Congress, but to actually get our work done. Too many families are going to suffer if we don't. We know already that there are some 1,400 cases of the Zika virus infecting Americans, whether in the mainland U.S. or in our 3 territories. Yet the only response we seem to have received so far from our House Republican colleagues has been 3 months delayed and about 33 cents on the dollar that the healthcare experts tell us we need to combat the Zika virus now and prevent it from becoming a catastrophe in the near future. And so it's time for us not to just punch the clock. It's actually time for us to get some stuff done. And in this case, it's a pretty clear sense of what we need to get done. Somehow, we can't convince our Republican colleagues that they should invest in providing the health experts what they need to tackle the Zika virus. Yet, less than 6 months ago, our House Republican colleagues found a way to fund $630 billion worth of tax breaks without paying for them. And so here we are with less than $2 billion that's been requested by the health experts to deal with a coming crisis, and our House Republican colleagues will not provide the resources that we need. But again, if a tax break were in front of this House for a vote, it seems like too many members in the House Republican caucus would vote for it. Taxpayers are looking for us to make wise investments with their taxpayer funds. They want to make sure that we're helping families. They want to make sure that we're tackling healthcare emergency like the Zika virus. And they want to make sure that Congress comes to work, doesn't just punch the clock, but works for them, and it works to tackle those issues that confront all of America. And so it's time for us to do more than just punch the clock. It's time for us to act on behalf of the American people who sent us here. With that, let me yield now to my colleague, Rosa DeLauro.
Thank you very much, Mr. Chairman. I'm proud to join with you and my colleagues this morning. You've talked about something that is really a national emergency, and it is a crisis. It is a healthcare crisis in the United States. You talked about the numbers, 1,400, but nearly over 300 of these cases have to do with pregnant women. We need to fully fund the president's request. He made that request in February. It is now almost June. What the House provided last week was only a third of the request. It will not cut it. According to the CDC, no one needs to take our word for it. According to the CDC, Center for Disease Control, pregnant women are already facing unacceptably long delays in learning Zika test results. CDC Director Tom Frieden has said that experts estimate that a single child with birth defects can usually cost $10 million to care for. That says nothing about what that child's life is about with microcephaly. delays in learning to speak, to hear, to eat, to walk. Imagine the terror and the fright of families. Some physicians are asking women not to get pregnant, arguing that avoiding conception is the only way to avoid the birth of a deformed baby. Is this the message that we want to give to American women? Ron Klain, the Ebola czar, wrote in the Washington Post, and I quote, "It is not a question of whether babies will be born in the United States with Zika-related microcephaly. It is a question of when and how many. For years to come, these children will be a visible, human reminder of the cost of absurd wrangling in Washington, D.C., of preventable suffering, of a failure of our political system to respond to the threat that infectious diseases pose. We need to put American women in a place of safety. Do not put them in the predicament of choosing whether or not they should get pregnant, or if they are already pregnant, wondering whether or not their baby is okay. You know, when we, and we're all here, we know this to our core, when we appropriate money for defense spending or wars, Republicans often say, and I'll quote, "Listen to the generals in the field. They are the ones that know the best." Well, we have generals in the field on this issue of Zika. They should be listening to the Center for Disease Control. They should be listening to the National Institutes of Health, and they should be listening to the science community. They have called for $1.9 billion in funding for us to be able to combat the Zika virus. We need to give them the resources that they need. It is the responsible thing to do. It is the moral thing to do. This summer, every woman who is pregnant or trying to get pregnant will be afraid to go to a picnic, to take their other children to Little League games or anywhere else, to sit out on a patio. We need to do all we can to ease those fears. We need to stop this disease from spreading any further. And months from now, when the results of our inaction become apparent, we will ask ourselves, why did we delay? Why did we wait? There are lives on the line, and this institution has the power and the ability to make that difference and to save lives. That's why people sent us here, to do something about it. Thank you.
Thank you, Rosa. Adam Schiff.
Thank you, Mr. Chairman. I want to add my voice to those that are calling for immediate funding at the President's requested level to combat this Zika virus. We are in an extraordinary situation here. American lives are threatened in Southern California, and in fact in much of the United States this summer. We expect to confront the Zika virus to a much greater degree, and that's a grave concern to all Americans, particularly to those that are pregnant or who want to get pregnant. This Congress must end its dysfunction. As an appropriator, as an American, this is just an appalling abdication of our responsibility. We are in an increasingly global environment in every way. And with changes in climate, we are seeing disease and with travel spread in far new ways and reach us in the United States in degrees we have never seen before. This is not going to stop. It's a function of the changing nature of the globe. What has to change with it is our ability to respond to these healthcare crises. And this is an ominous portent of dysfunction and disaster to come. If we cannot muster the funding proactively to deal with this Zika crisis, how will we handle the next one? The number that the President has asked for was not plucked out of a hat. It is what the healthcare experts say is needed to combat this, for education, for prevention, for research, for treatment, for all of these things, none of which we can afford to inadequately fund or invest in. I don't want to be here a year from now to have to confront those suffering from the effects, to talk to mothers of children born with very serious birth defects that could have been prevented had we done our job. So let's do our job. We can't leave this building, we can't leave this place next week without doing our job. Let's pass the funding we need to confront the Zika crisis. Let's show the American people we're capable of acting. The GOP majority needs to get its priorities straight. It needs to end its own dysfunction, and we need to deal with this Zika crisis, and we need to deal with it now.
Our Vice Chairman, Joe Crowley.
Well, firstly, let me join the chairman in thanking the two members of Congress who joined us here today, Rosa DeLauro of Connecticut and Adam Schiff of California, two appropriators who understand the importance of attacking these critical issues head-on and with the resources that they need in order to meet that challenge. Zika and the issue of water in Flint are first and foremost public health emergencies. The Republicans' dismissal of both the urgency and the gravity of these issues is not just wrong, it is terribly irresponsible. They dragged their heels on Zika for 3 months despite public health officials stating the urgency of the crisis over and over again. They voted 4 times against funding and instead passed a bill that meets only 1/3 of the funding needs that our generals in the field that Rosa DeLauro talked about said that we needed. And they've all but ignored the public health crisis in Flint, where an entire community is suffering because of the neglect of its local government and its state government. For all the lip service, Republicans are oddly silent when it comes to Flint, silent to the need to help, silent to the cost of doing what is right, silent to the urgency of the issue. And let's not forget that what led to this crisis in the first place. The people of Flint need to know that their government and that their Congress has their back. The American people want to know whether or not their Congress will have the back of theirs if the same thing happens to them in their community. Just as they want to know if their Congress will have their back when it comes to Zika or to any other emergency. Because it begs the question, if the Republicans in Congress can't even have the back of the American people during a public health crisis, when will they have their back? That's what the American people want to know.
Questions? Mike.
Does this mean, Leader Pelosi said over and over again that the 1.1 billion that the Senate is moving is not half a loaf, it's half a shoe, implying that it's not good enough in any event and she would oppose it. Is that the sentiment within the Democratic caucus on the whole?
Certainly every member has to make a decision for himself or herself, but if your doctor is telling you you need to take 2 pills every day to stay healthy, and you decide to take, or 3 pills to stay healthy, 3 pills, you have to take 3 pills every day to stay healthy, and you take one of those 3, I suspect you're not going to stay healthy. And if the healthcare experts are telling us if we want to avoid a healthcare catastrophe, especially for women who are pregnant and newborn children, that we must fund these efforts on Zika eradication properly, that 33 cents on the dollar of what you need is not going to do it. And so most of us are saying to our Republican colleagues, let's do what we have to do. People pay taxes so that our government will do what it has to do. And so we know what we have to do because the generals, as Rosa DeLauro has said, have told us, the healthcare generals have told us what we have to do. It's not rocket science. You take 1 pill when the doctor tells you to take 3, chances are it's not going to help you maintain your health. You provide 33 cents on the dollar of what the healthcare experts say we need to avoid a healthcare catastrophe with the Zika virus, and we're probably not going to avoid the healthcare catastrophe. So it's a pretty simple question. Republicans should need to answer that question if they're ready to actually step to the plate and do their job instead of just punch the clock.
So do you oppose it?
I would not support inadequate funding to deal with the healthcare catastrophe that could result if we don't tackle the Zika virus the right way. I don't know if my colleagues might.
I think the American people would understand that we're doing everything we possibly can do to end the threat that Zika poses to the United States. Are they going to be mad at us if we spent a little bit more? Will they be mad at us if we spent not enough? That's the real issue here. If we don't have enough resources to attack the problem. I believe when it comes to an issue like this, we put as much resources as we possibly can that the generals are asking for. Solve the problem and deal with the other issues later. This is a life-threatening issue. This is not something you just do willy-nilly or haphazardly. We need to put every possible resource in the field to stop this crisis. That's what the American people expected their Congress to do. Whether it's during wartime, there's no question of funding when it comes to war. There's no question of funding or how much we're going to spend. We will spend whatever we need to do to end the crisis, to stop it. Here, when it comes to the issue of health care, and the issue of Zika specifically, and I would also say Flint, well, how much can we get away with doing? How much, maybe we don't need that much. That's so tepid. You don't solve problems being tepid. You solve problems being bold and expending the resources that are needed to end the crisis. And that's not what the Republicans are doing right now.
Anna, do you want to comment?
It seems like one of the ways the House and Senate might resolve this is to add more money than the House bill, but insist on some spending cuts or offsets to accompany that. Those types of offsets were routine in the 90s and when the Republicans controlled both houses of Congress. Is that something you might be able to live with?
If you're speaking to what Republicans have proposed, that we take funding from or resources from the Ebola efforts to prevent Ebola from becoming another crisis, that's simply taking money from Peter to give it to Paul and allowing Peter to become very ill in the future. It doesn't make any sense. When you have an emergency and you have a crisis, you tackle it head on. You don't wait until it becomes a catastrophe. We didn't wait, actually, unfortunately, under the Bush administration, we did wait a little long when Katrina hit Louisiana, and we saw the impact of not having the preparation in place. I don't believe any American is expecting us to put in jeopardy one family member to help another family member. And so if Republicans can tell us where they'd like to steal resources from to tackle the Zika virus, we're willing to listen. But if it's being done at the expense of other Americans who have paid their taxes to get their services from their government, then that's not the way to do business, in at least not for the American taxpayers. And so we would urge our Republican colleagues to stop playing games and fund this potential catastrophe as we must, to make sure it never becomes the catastrophe that we're being told it will if we don't do it right away. Other questions?
New topic?
Different topic. There's some criticisms coming in to Secretary Clinton because of donations that were made to her husband's foundation, the Clinton Foundation from Saudi donors. Do you think that voters should be at all concerned should Secretary Clinton become president?
I think that the Clinton Foundation does great work around the world to help uplift lives around the world. And I think that when Hillary Clinton is elected president, she will do great things to uplift America, and in doing so, also help to uplift the world as well.
But you don't think there's any conflict of interest with Saudi Arabian donors, too? The Kingdom of Saudi Arabia, part of Saudi Arabia.
I echo what the Vice Chairman just said. Anytime you can help eradicate HIV and AIDS, anytime you can help lift people who lived in poverty, we want to be supportive of that. And the Clinton Foundation has done some tremendous work throughout the world, including in the U.S. And what we want to be able to do is support the activities of organizations that will try to do good work for people who are working for themselves but need a little bit of extra help. As the Vice Chairman just said, Secretary Clinton, when she becomes president, will be able to team with all those different not-for-profits and all those organizations that are out there trying to help people who are working for themselves but can use a bit of a hand. And I think what you're going to find is we'll have an administration and President Clinton, Hillary Clinton, that will work to try to not only deal with poverty, but make sure that people have real opportunity. Certainly in this country, we want to restore the American dream to what it was. And that's why I think so many of us are so actively engaged in trying to help Secretary Clinton become President Clinton.
So it shouldn't matter where the money comes from, even if it's a country for human rights.
I think we try to answer that. So long as you're talking about the good work of foundations that try to help people who are trying to lift themselves up, I think we want to applaud that. And there are rules the way you can do that. And so long as the rules are followed, I think everyone would agree. Let's try to help those organizations that are helping people lift themselves up. Any other questions, Mike?
Just back on Zika quickly, Mr. Chairman, can you just explain the balance between getting something, the necessity of getting something done quickly and the necessity of getting the full funding? In the analogy you used, would you rather have 2 pills now or 3 pills in a month? How do you balance the time and the money aspect?
Right. So we're not sure why our Republican colleagues who control the House and the Senate can't find the resources to pay for the Zika work that must be done to prevent Zika from becoming a full-blown crisis. We've been told by the healthcare experts at CDC and NIH and the scientists who really understand the Zika virus that we need something approaching $2 billion, which may sound like a lot of money to a lot of people, and it is individually. But if you take the more than 320 million Americans, and you, as Congresswoman DeLauro mentioned, that one infection could cost us $10 million in and of itself, and that's not even talking about the human costs to that individual who becomes infected. It's clearly a good investment. But when you contrast it, what our Republican colleagues are willing to do with taxpayer money. So less than 6 months ago, as I mentioned, Republicans in Congress put forward a bill that took about $630 billion in taxpayer resources and gave it away in tax breaks, never asking for payment of that $630 billion. Here we're asking for $2 billion, not $630 billion, to deal with what we know is coming, a crisis that could impact the lives of so many people, especially women, pregnant women, and newborn children. And why we can't, in this Congress, come up with the $2 billion to deal with this healthcare crisis when you could come up with $630 billion for tax breaks, it makes it very difficult to understand. Taxpayers in America are paying their taxes. They're paying them so they can get their services. We need more than a Congress that's going to punch a clock but not recognize where we must invest those taxpayer dollars and how we can do our job.
But the scientists and the generals that you're referring to, they also say time is of the essence. Is it worth dragging this out more towards 4th of July just to get the 1.9 billion if there's a deal to be had at 1.1 million?
If you talk to Dr. Anthony Fauci at the NIH, National Institute of Health, who deals with infectious diseases, he will tell you that we don't need a pill, a part of the money here and then part of the money later, because you have to engage in the actions that will give you a comprehensive approach to dealing with Zika. Just the way a general would tell you, yeah, you can fund me a third of what I need, but what are you asking me, to not train certain troops and train others? Give certain troops their armor and protective gear and vests that they need and not others? Are you telling me to make sure that some troops go into a theater of engagement with air cover and other troops that we'll send into theater of engagement without cover? It doesn't work that way. And if the generals on this healthcare crisis had said, sure, you can give it to us in installments, a third at a time, then we'd be working with that. But the generals have said they need the $2 billion now because they're already falling behind. 1,400 Americans have already contracted the Zika virus. We need it now. And 3 months after being told we need it, for Republicans to still be playing this game of, well, we're not sure if we can and how much we'll do, is simply to say you're going to punch the clock for the American people but not get the work done.
I just want to suggest that what we're looking for is a prophylactic to help people prevent from getting the disease in the first place. And we're not there yet scientifically. We just haven't gotten to that point yet. If this were war, Congress always knows best, I guess, but except when it comes to war. We listen to our generals. When they say we need X amount of tanks or X amount of airplanes or X amount of bombs or X amount, whatever it may be, We basically give them what they ask for. And in fact, in this Congress, they give them everything and even more than they asked for when it came to the budget this year. It's just astonishing to me that when it comes to science, the Republicans continue to just keep putting their heads in the sand. Now, not completely here, because at least they're acknowledging that there's a problem. But once again, it's Congress knows best, and we know more than the scientists. We understand this more than the scientists do. Well, I got to tell you, people live in Florida right now, people living in Texas and in California and other parts of the country where this is more of an immediate threat, like Puerto Rico. It's a threat to all of us, but think of the economies of these states. The threat that we see that's happening in Puerto Rico, potentially in Florida, in Texas, and elsewhere. And if that spreads, the effect it'll have on our nation is catastrophic. So we need to address this head on, not to do this in a mealy way, but to do it in a wholehearted way to end this crisis.
Congressman Schiff?
Just want to underscore how differently we would handle this if this were a natural disaster that had just struck the United States. We would be pouring in the resources needed to help people. We have a chance to prevent the worst impacts of Zika, but only if we act now. And I think this is not only important in terms of the immediate crisis that we face with Zika, but important as a precedent because we're going to face other public health crises as we did with Ebola. And we have got to do a much better job. This Republican leadership has got to make the decision to do its job to protect the country. That's the principal responsibility of government, is protecting the public. And here, this is unlike, Javier and I come from California. We're used to earthquakes. We know another big earthquake is coming. We don't know when. We're trying to prepare. But we know when Zika is coming. Zika is already here. And we know when Zika is going to be at its worst. So failure to act now in the face of that is just completely irresponsible. It's time to get this job done. It's time for the Republican leadership to devote the resources that the experts say is necessary to meet the crisis. Otherwise, they're going to have a lot of hard questions to answer from pregnant women, from other women who've given birth to children with terrible birth defects. They're going to have to answer the question why they didn't act when they had a chance to prevent this. And those are not questions that they're going to want to hear. They're not questions that anyone in Congress is going to want to hear. So let's please get this done now.
Thanks all very much.
Congressman, can I get one reaction question on the member's affairs?
We could do it separately here. Thank you.